Okay, so today we're diving deep into something you might have actually observed in your own dogs, those, furry members of our family's compulsive disorders.
Yeah, it's a really fascinating area. We've dug into some great sources that really unpack these behaviors. We're going to look at what they are, maybe why they happen, and how they're usually tackled.
Exactly. And our goal here really is to get past those simple labels like, oh, he just chases his tail a lot.
Hmm,
We want to dig into the actual details of these abnormal, repetitive behaviors.
right. So you can feel like you really get what might be going on under the surface.
Because it's not just one simple thing, is it?
No, not at all. It's actually quite a diverse group of conditions, different causes, different expressions. Understanding the specifics is really, really key.
Okay, so let's start there, defining them. The sources use this big term, abnormal repetitive behaviors. What actually falls under that umbrella?
That's the starting point, yeah. Think of it as a broad category. Generally, they fall into a few main types. You've got locomotor things.
Like movement-based stuff.
Exactly. Spinning, tail chasing, circling, running back and forth along a fence, even chasing lights or shadows, that kind of thing.
Okay, what else?
Then there's oral behaviors, so things involving the mouth. Persistent licking, maybe sucking or mouthing at their side or their tail or leg.
Ah, okay.
You also see pica, that's eating non-food stuff or drinking way too much water, or even that weird fly biting thing.
Fly biting. Yeah, I've heard of that. It sounds really strange.
It is a bit odd. It often looks like the dog is snapping at invisible flies.
Yeah.
And it sort of bridges into this other category, which is almost hallucinatory.
Hallucinatory, like what?
Oh, besides the fly biting, you might see dogs repeatedly checking their back end, almost like something's bothering them there.
Right.
Or they might just freeze suddenly, staring blankly, sometimes with whining or, other emotional sounds.
Wow. So these aren't just like little habits dogs have. When does it cross the line into being a compulsive disorder?
That's the million-dollar question, isn't it?
Hmm.
It crosses over when the behavior becomes abnormal. Either it happens way too often or it's super intense.
Okay.
It's repetitive, obviously, often exaggerated or goes on for a long time. It might look slightly different each time, but there seems to be this goal fixation behind it.
A goal fixation.
Yeah, like they're driven to do it. And what's really interesting is that a lot of these seem to start from normal dog behaviors, grooming, hunting instincts, eating.
So like a normal behavior gets stuck on repeat or amplified.
Exactly. It's like the brain circuits for those normal things get kind of scrambled or stuck in overdrive. It really shows how fine that line can be in the brain.
That makes a lot of sense. Now, the sources also mentioned stereotype eyes. How are they different from these compulsive behaviors?
That's right. Stereotypus. They're also repetitive, but the key difference is they tend to be really rigid, like exactly the same sequence every time.
Okay, more robotic.
Kind of, yeah. And crucially, they don't seem to have any obvious goal or purpose. It's just the action, over and over, seemingly for no reason, unlike the compulsive ones, which feel like a distorted goal.
Gotcha. So compulsive is like a work drive. Stereotypy is more like a stuck loop. What kind of things might trigger stereotypies?
The sources often link them to conflict or frustration,
Mm.
especially related to the dog's environment.
Like being cooped up.
Yeah, confinement, not having enough to do, not enough ways to, be a dog. Things like being separated from their mom too early can also play a part. So environment is a big factor there.
Which leads us to the why inside the dog, right?
Yeah.
What's happening biologically?
Exactly. Let's get into the pathophysiology, what's going on in the brain and body.
Yeah, the nuts and bolts.
Well, it seems pretty clear that brain chemistry is involved. Neurotransmitters aren't working quite right. Serotonin seems to be a really big player, especially in the compulsive disorders.
Serotonin, right. Often linked to mood.
Mm-hmm. But dopamine and maybe even endorphins are likely involved too, perhaps more so with those stereotypes as we mentioned.
So it might not be just one chemical, depending on the specific behavior.
Precisely. It's likely a complex mix, and different neurotransmitters might be more dominant depending on what the behavior looks like. And it's not just general brain chemistry either.
Yeah.
Different disorders might actually involve different parts of the brain more specifically, so specific circuits might be affected.
Which really drives home that these aren't just bad habits. There's a real biological thing happening. And it doesn't just affect their behavior, right? The sources mentioned wider effects.
Oh, absolutely. It can ripple outwards. Behaviorally, sure, more fear, anxiety, sometimes even aggression, but physically too.
Like what?
You might see their heart rate go up, tachycardia. their whole stress response system, the HPA axis, can get ramped up, which makes sense, right?
Yeah.
If they're anxious.
Yeah, totally. It's all connected. What else on the physical side?
Well, you could see digestive issues. Maybe they don't want to eat or they get stomach upset, sometimes leading to them eating things they shouldn't, which is dangerous.
Right, the pica thing.
Exactly. Their blood work might even show signs of stress. They could lose weight or injure themselves from the repetitive action. Breathing might get faster. And skin issues, definitely sores, infections from all the licking or chewing.
Wow, it really can take a toll. So, are some dogs just more likely to develop these things? What about genetics? Breeds?
Yeah, genetics definitely seem to be involved. There's evidence for a predisposition to susceptibility.
So it runs in families?
It looks like it. You
Yeah.
see it more often in dogs related to dogs that already have it. But interestingly, how it shows up might be different.
Meaning?
Like, in the same litter, one pup might develop obsessive tail chasing. Another might constantly lick its paw. Same genetic link, maybe, but different behavior.
Fascinating. So it's not super common overall, but some breeds are more prone?
That's right. Generally uncommon, but definitely more common in specific breeds or family lines. And this is where you see some really interesting patterns.
Oh, yeah. Give us some examples.
Okay, so bull terriers, for instance. They seem more prone to spinning and that freezing behavior. German shepherds, also spinning and tail chasing.
Huh. Almost like breed signatures.
Kind of. Great Danes, German short-haired pointers, you see more of the self-licking or chewing, the fence running, maybe those hallucinatory type thing.
Any others stand out?
Dobermans are often linked with flank or blanket sucking, miniature schnauzers, that hind end checking, and border collies are kind of famous for the light and shadow chasing.
Wow, quite specific. When do these usually start showing up? Is there a typical age?
Yeah, it often emerges around sexual maturity, say 6 months or so, up through social maturity, maybe 12 to 24 months. That seems to be the main window.
So adolescence, early adulthood.
Pretty much. Though some reports mention it starting even earlier, like 3 to 6 months. And also, some of these might be a bit more common in male dogs.
Okay, so if you're an owner, how do you tell the difference between just a weird habit and something potentially serious? What should you be watching for?
Yeah, that can be tough. Because like we said, some stem from normal stuff.
Mm.
The key is looking for frequency, intensity.
Hmm.
Is it happening way more than seems normal? Is it really intense? Does it seem out of place?
Right.
And, the dog might not even do it when you take them to the vet for a quick checkup,
Ah, good point.
which is why owner descriptions are so important. And videos. Getting it on video is incredibly helpful, both for figuring out what it is and seeing if treatment's working later on.
Makes sense. What kind of background info would a vet want to know?
They'll ask about any other signs of anxiety, separation issues, fears, aggression history, and they'll definitely ask about stress,
Stress
like not enough mental or physical stimulation. Maybe punishment was used in training, or maybe there was a big change recently, a new routine, someone moved in or out, that kind of thing. You need the whole picture.
Right, the dog's whole life context. How do these behaviors tend to change over time if they are compulsive?
Well, often they might start small, maybe during play or when the dog's really wound up or stressed.
Uh.
But then it can kind of generalize. It starts happening in more situations, sometimes with no obvious trigger. Like the blanket sucking might just happen when the dog's bored or alone.
Hmm.
And if punishment has been tried, the dog might just learn to do it when you're not looking.
Sneaky.
So it takes on a life of its own. What are the big red flags, the hallmarks that really scream compulsive disorder?
Okay, key things to look for. The behavior often becomes really ritualized, like a set pattern. It's usually an exaggerated form of something normal. You probably see it happening more often, more intensely, and for longer periods over time.
And it's hard to stop them.
Very hard. Sometimes impossible to interrupt, even if you try to physically stop them.
Hmm.
And the big one, it starts getting in the way of normal life. Eating, sleeping, playing, interacting.
That sounds really distressing for the dog.
It really can be. What seems like just an odd thing to us can be a sign they're really struggling.
And are there physical signs vets look for too? Sometimes the exam is totally normal, but yeah, they'll look closely for self-injury. Sores, raw patches, especially on the tail, legs, paws, maybe worn down or broken teeth. Lameness, sometimes. Even just poor overall condition if it's interfering with eating or rest.
So it sounds like there's rarely just one single cause. It's more like a mix of things.
Exactly. No single smoking gun, usually. It's a combo. We talked about genetics.
Right.
But environmental stress is huge. Think of kennel dogs spinning. That's a classic example. How the dog is managed day to day, any underlying health issues.
Even things we do?
Yeah, sometimes we accidentally reinforce it without realizing.
Eh.
And really importantly, underlying medical problems. Pain, nerve issues can definitely increase anxiety or even be the primary driver for some repetitive actions. Sensory issues too, like poor eyesight.
So it's not always just in their head.
Definitely not. Ruling out physical causes is step number one.
Okay. Which brings us neatly to diagnosis and treatment. How do vets figure this out, for sure?
First things first. Rule out the medical stuff. Skin disease, tummy problems, hormone imbalances, neurological issues, bone or joint pain, nerve problems. The list is actually pretty long.
Wow.
All those things could cause behaviors that look like a compulsive disorder. And you also have to distinguish it from other behavioral things like displacement activities, just normal play, maybe attention-seeking, or simple boredom.
So a lot of detective work needed.
For sure, it requires careful observation and ruling things out methodically.
What kind of tests help with that?
Basic blood work is usually a start. CBC, chemistry panel, urine test, gives a baseline health picture, and it's crucial before starting meds anyway.
Okay.
Interestingly, sometimes dogs with these issues might show subtle changes, like maybe a higher red cell count or higher cholesterol or triglycerides, possibly linked to stress.
Huh.
Then, depending on suspicions, you might need more specific tests. Maybe imaging like CT or MRI if you're worried about the brain, or X-rays or ultrasound for other body parts.
Okay, so once medical causes are ruled out as much as possible, what about treatment? Do you always need to treat it?
That's a really good point. Not necessarily. Sometimes a repetitive behavior might actually be a coping mechanism for the dog.
Like, it helps them deal with stress.
Kind of, yeah. So if the behavior isn't hurting the dog, isn't causing them obvious distress, isn't damaging your relationship, maybe intervention isn't the best idea. It could just draw more attention to it.
So assess the impact first.
Exactly. Judge based on the dog's overall quality of life.
But if treatment is needed, what's the approach?
It's almost always multi-pronged. You need to hit it from different angles. Usually that means environmental changes, behavior modification, and often medication.
A combination.
Yes. And the sources suggest that starting meds earlier can sometimes help the behavior therapy work better because it takes the edge off the underlying drive or anxiety.
Right. Tackle the chemistry and the habits. What kind of environmental changes help?
The goal is to lower the dog's overall stress. So identify triggers and remove them if you can. Or use techniques like desensitization and counterconditioning to change the response to those triggers.
And definitely no punishment, right?
Absolutely critical. Punishment is a big no-no. It usually backfires, increases anxiety, makes things worse, or just teaches them to hide it.
So what should owners do in the environment?
Structure and routine are key. Predictability helps anxious dogs. Plenty of appropriate exercise, mental enrichment puzzle toys, training games, interactive play with the owner, and sticking to positive, reward-based training methods. Create a safe, stimulating, predictable world.
Okay. And the behavior modification part, what does that involve?
That might mean teaching relaxation exercises or training an alternative incompatible behavior.
Incompatible.
Yeah, something they physically can't do at the same time as the problem behavior. Like if a dog circles, you teach them to lie down calmly on cue, settle, or head down, and reward that heavily.
Ah, okay.
Yeah.
Redirect them.
Exactly. Sometimes a head collar can help gently redirect. The idea is to anticipate the behavior, interrupt it before it gets going, redirect to the good alternative, and reward. Keeping logs, maybe even videos, helps track what's working.
Sounds like it takes consistency. What about the medication side? When is that brought in and what's typically used?
Meds are often considered if the behavior is really severe, if it's seriously impacting quality of life, or if the behavior mod just isn't enough on its own.
And what kind of meds?
Primarily, you're looking at SSRIs, selective serotonin reuptake inhibitors, or TCAs, which are tricyclic antidepressants.
Because of the serotonin link we talked about.
Exactly. They target that serotonin system. Common SSRIs are things like fluoxetine, sertraline, paroxetine. For TCAs, clomipramine is often mentioned as being particularly good for these issues because it strongly affects serotonin.
Makes sense. Anything owners need to know if their dog goes on these precautions, side effects?
Oh, definitely. Lots to consider. First, contraindications. They might not be safe for dogs with serious liver or kidney issues, or certain heart conditions for some TCAs.
Oh,
Combining them with other serotonin-affecting drugs needs extreme caution risk of serotonin syndrome. Side effects can happen, maybe sleepiness, appetite changes, sometimes even a temporary uptick in anxiety initially.
hmm.
And these are often used off-label in dogs, meaning not specifically approved for this use, so that vet discussion about risks versus benefits is vital. Drug interactions are possible too. Close monitoring by the vet is non-negotiable.
Sounds like very close partnership with the vet is needed. Are there other medication options sometimes used?
Yeah, a few others are mentioned. Sometimes things like synthetic pheromones or supplements like L-theanine or alpha-casozapine are added to help with anxiety.
Okay.
Other antidepressants like amitriptyline might be tried. Selegiline, memantine, narcotic antagonists, those are less common or practical. Antipsychotics are generally not recommended. Side effect risks are often too high.
So SSRIs and those specific TCAs are really the main tools. How does management work long term?
Regular vet check-ins are key, often including blood work to monitor things, especially with long-term use. Owners need patience. These meds can take 8-12 weeks, maybe longer, to really show their full effect.
So don't expect overnight changes.
Definitely not. Early signs might just be the episodes getting shorter or less frequent, and relapses can happen, especially if things get stressful again. So you might need to step up the behavior mod or use short-term anxiety meds sometimes.
What about preventing this in the first place? Especially in those breeds that are more prone.
The main thing is awareness. If you have a puppy from a line with known issues, monitor them closely as they grow up. Early recognition of any repetitive quirks and jumping in with positive training, enrichment, maybe professional guidance early on might help head off a more serious problem.
And the potential downsides if it's not treated.
Well, like we mentioned, significant self-injury, skin, muscle, bone issues, stomach problems, and just the chronic stress and anxiety taking a huge toll on their overall well-being and quality of life.
What's the typical outlook? Can dogs get better?
If untreated, it usually just gets worse, sadly.
Yeah.
But with that full package meds, behavior mod, environmental changes, the sources suggest you could see a really good reduction, like over 50% improvement in maybe 2/3 of cases.
That's pretty hopeful.
It is, but owners need realistic expectations. A total cure is rare. It's often about lifelong management. And definitely, things like amputation for tail chasing. Almost never recommended. It doesn't fix the underlying brain issue.
Right. So pulling this all together, it's clear these repetitive behaviors are way more than just funny habits. There's brain chemistry, maybe genetics, definitely environment all interacting.
Yeah, and careful observation from you, the owner, plus getting professional veterinary help, those are absolutely the crucial starting points for figuring it out and managing it effectively.
And really understanding what's going on inside, knowing the treatment options, that empowers you to give your dog the best possible support, doesn't it?
Absolutely. It helps you be their best advocate.
You know, considering how these often start from normal drives, just kind of twisted, and how much biology and environment play a role, it really makes you think, doesn't it?
Yeah.
About that delicate balance of well-being, not just for our dogs, but maybe for us too.